Hey, gorgeous. Welcome to season 6 of the Hormone Puzzle Podcast. I'm your host, Dr. Kayla Smith, a holistic integrative doctor specializing in fertility and hormone health. If you're looking for insights into hormones, fertility, and all things related, you've come to the right place. Tune in weekly as we interview amazing experts in the field of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're finally going to help you put those pieces of your hormone puzzle back together so that you can get and stay pregnant and eliminate all your hormone-related symptoms for good. Are you ready? This season, we're focusing closely on fertility and hormone health with an amazing lineup of expert guests sharing groundbreaking knowledge, bringing you stories and advice that will support you in your fertility journey. We're here to lift your spirits, give you a virtual hug and inspiration, as well as empower you to take charge of your fertility and your health. Thank you so much for tuning in and for being an amazing listener. So now, let's get started on your road to transformation. Let's start piecing together your hormone puzzle one step at a time. On today's show, we have Caitlin Estes. She has used the Creighton system for over 12 years and has taught Creighton for 8 of those years. She reached the highest level of education in her field as a certified fertility care practitioner and leads a recognized Fertility Care Center of Excellence. She is passionate about women's health and God's presence in it. She believes that each woman deserves to understand her body and her fertility. She hosts Woven Well, a natural fertility podcast, and writes weekly on topics of fertility and faith at wovenfertility.substack.com. She also writes for Natural Womanhood. On today's show, we're going to talk to Caitlin about fertility awareness, specifically the Creighton model, and how this is the key to solving infertility. Now, let's welcome Caitlin to the podcast. Hey, Caitlin, welcome to the podcast.
Hi, thanks so much for having me.
Yeah, I'm so excited to have you back. I know we had a great conversation when you were on our Solving Infertility Summit, and I know the podcast audience is going to love you just as much as that audience, so I'm excited.
Well, I always love talking about how to empower women, and I think fertility awareness is a great way to do it.
Sure. Me too. We're just going to dive right in today because we do have a lot to cover. So tell us a little more about you and how you got into this work that you're doing.
Sure. I actually started learning a form of fertility awareness when I was engaged and looking for options to plan my family. I wasn't really sure what I wanted to do, but I knew I didn't want to do birth control. And that's just because I had friends who had horrible experiences like liver tumors, blood clots, like big kind of stuff. And so I knew that that was not for me. And so I started looking into other options. I literally Googled, what are natural options? And a whole new world opened up to me. And so I began learning it myself, my fiance at the time and myself, we began learning it. And soon I became that friend that knew all about menstrual cycles and fertility and ovulation and all these things that I thought that everyone knew, but I didn't really know a lot about it before that education. And so I started to realize how powerful it was for women to understand their cycles in a way that allowed them to confidently plan their families and advocate for their health. And that was 8 years ago. I went through my education program, felt invited to do this in a more formalized way. And it's just continued to grow and grow as has my passion for it.
Oh, I love that. And I think, as we've talked in the past, fertility awareness is so powerful because it really does allow the person to track their signs, learn when they need to be having intercourse if they're trying to get pregnant or when to avoid. I think it's such powerful information that every woman needs to know. So I love that we're talking about it. Yeah.
Totally agree. Absolutely.
Yeah. So tell us just broad terms, what does fertility awareness mean?
Yeah, it's a good question because you hear a lot of different terms out there. But when you think about fertility awareness, as the name kind of suggests, it's all
Mhm.
about being knowledgeable or in tune or aware of your own fertility and reproductive health. I think most of us just know whether we have regular cycles or painful periods, but anything beyond that feels a little bit of unknown. The best we can get is maybe a lab draw or an ultrasound from a doctor that gives us some sort of insight. That's at least what it feels like. But actually, our reproductive systems are giving off a ton of information about our health, our hormones, our cycles. It's just that we haven't been taught how to spot and interpret those things.
Mhm.
This is where fertility awareness comes in. These are modern evidence-based methods that take these reproductive biomarkers that we have, so our body sending out signs about what's going on, that we are naturally producing, and it gives us a way to make sense of them so that we really can support our health, advocate for our needs, plan our families, the things that I listed a minute ago. And so there are lots of different forms of fertility awareness, and they're all based around those reproductive biomarkers. So you could do a method that focuses on cervical mucus, which is one of the primary signs. There's basal body temperature, luteinizing hormone, or you could do a combination of the three with additional symptoms as well. You may have heard of like doing cervical checks or things like that. The one that I specifically teach is called the Creighton model system, and it is a long-standing, highly trusted method that uses cervical mucus only. And it actually has a field of medicine associated with it, specifically for reproductive health, called naprotechnology, which just stands for natural procreative technology. And so it was established because of how much information Creighton charting can provide to help diagnose and treat women's health issues. So it's a really broad world, but you can kind of find specifically what suits you best, maybe based on a lot of different specifications, maybe your cycle type or what you're trying to, what your goal is there. And it's a really fun field.
I love that. I love that. And, it's some of the things that I teach my patients is how to track and how to look at that cervical mucus and how to time their intercourse around, especially if they're struggling with infertility. So I know it's a wonderful model. So talk to us a little bit about that, maybe specific cases that you've had where you've taught somebody this and it's really impacted their, their health or their cycle. Do you have any client stories to share?
Well, when you think about infertility, it kind of feels like how in the world could fertility awareness make a difference, Like when you've been through so much, then it's hard to imagine that something so simple could help. Something that they could actually participate in, like they can do something and it's going to make a difference. But like I said, with a method like the Creighton model system, they're really powerful tools when they're in the right hands. So yes, I've had clients who have been told that IVF is their only option. Maybe they went through several rounds of IVF and it was unsuccessful, or they felt like it was invasive or too expensive. And they just thought, okay, that's it. There's no other options. Like that's the most you could ever do. And they've been amazed that just using the Creighton system and partnering with those naprotechnology trained or restorative reproductive health medical professionals can really have a totally different experience.
Sure.
Yeah.
And can you talk to us? I know that we could spend the whole show, and I don't feel like we need to train the audience how to use the Creighton model because that's what practitioners like you do, but just basics around what are we looking for when we're trying to track our cervical mucus?
Yeah, well, cervical mucus is produced every single day by the cervix. So it's not just one time this happens. So we actually train you on how to be on the lookout for that at all times. And then as you notice different changes throughout the cycle, being able to interpret that. So maybe you notice that your cervical mucus starts out sticky, tacky, cloudy, and then progresses into a clear, stretchy, or lubricative type mucus. That's usually letting you know that your estrogen is rising and you are approaching ovulation. So you're getting into that window of fertility. So that's a lot of times what people think the basics of any sort of fertility awareness method is identifying that window of fertility, but it's actually a lot more than that too. It's identifying the health issues that are going on as well. That's one of the things I love about the Creighton model system specifically, is that it really gives you an incredible insight to what may be going on under the surface. What's the root cause of some of these symptoms? And it seems kind of funny to think that cervical mucus could give you that information, but it absolutely can. The quality of it, the timing of it, the amount of it. We're trained in how to teach you to see those things, but then we partner with medical professionals who are trained in how to use that information to diagnose and then restore those underlying issues. So that's a big picture overview. You're right. It's hard to kind of give any more instruction than that, but at least to kind of guide on the detail of the cervical mucus actually matters a lot.
Gotcha. And what about if somebody says, well, I don't see any cervical mucus. I don't have any. And I have people tell me this and I'm thinking, you have to have some, but so what do you say to those people when they maybe they don't know they have it or they're not seeing it?
Yeah, I think it could be either of those situations. So it could be a situation where they don't notice it. It's there, it's being produced, but they just don't happen to catch it. That's where partnering with the Creighton system actually is really helpful, like having a practitioner who can teach you, because there are ways to make sure that you will never miss it. And it's not like a really annoying thing. It doesn't take up a ton of time in your day. It's just kind of a change in mindset and certain tips and strategies to help you be aware of it. And then the other side is maybe they don't actually have any cervical mucus. This is a situation within NAPRO technology that we call dry cycles. So I have certainly had women that come to me, we start charting, and it's just dry every single day. I make sure that they really are looking for the things that we want to identify. They're just not seeing them. That is actually just as helpful of information as if they had a cycle with lots of cervical mucus or only during certain times, because everything that you're charting, everything that you're observing and then charting actually gives us valuable information. We don't expect your chart to look like this perfect, quote unquote, perfect standard example. We expect it to look like you. We expect it to look like a reflection of what's going on in your reproductive system. And so we want to see things that may be a little bit unexpected or abnormal, because we want to help identify what's causing that. Those are little yellow flags that are pointing us in a specific direction.
Sure. And that's what I try to explain to my patients and my audience is if you're not having cervical mucus, that's also a sign that we need to track and there might be something going on there and we need to check that out. So I love that you said that and I completely agree. What about trackers? I know we've talked about this before, but do you have any, are you a pen and paper girl? Are you an app? What do you recommend to your clients for tracking devices?
Yeah, it's a good question. When you think about so many options are out there right now, sometimes that can feel a little bit overwhelming. Again, I teach the Creighton model system, so we do actually provide you with a paper chart to begin with. I am a big fan of learning on a paper chart, not because I'm ancient, but because you can actually cross things out and redo things. And it's very literally hands-on. And I think that actually helps the learning process. It feels easy to have an app, and easy is definitely great, but I would rather it be accurate than easy. So I think in the learning process specifically, it can be beneficial to have paper and pen sort of a thing, but there are a lot of options out there. For instance, once you learn the Creighton model system, there is an app available that you can use. But at that point, you've already learned how to do it. You know what you're looking for. You've got to go back and forth with your practitioner and change things as you need to. So typically, I say to start off that way. And I'm not always a huge fan of apps that you can just get on the App Store, because most of those are going to be using algorithms and sort of guesses as to when you're fertile and infertile. And that's not helpful. But in addition to that, it's not really giving you any data about your health, about your overall reproductive health. And that's the big game changer with the Creighton system.
For sure. And I love that. I'm a pen and paper girl, myself. I think, especially when you're getting started and you're learning something, it just helps to have that tangible, tool that you can use.
Yes.
So I love that you say that. Now, what about our partners, our husbands? Is there any way for them to support us through this? I think you had a fun story last time when I asked you this question, but I would love to hear again, any way they can support us.
Well, it's really important that when we think about using any form of fertility awareness, we're doing it as a couple. So you can use it as a single woman. You absolutely can do that. And you get just as much information. You can learn about not only your fertility, but also your women's health. So fully support that. And I work with ladies all the time who are single and doing that. But if you're using it for fertility purposes, you're trying to avoid pregnancy, you're trying to conceive a pregnancy, then it takes two to tango, right? I mean, we're in this together. And so sharing the responsibility of fertility awareness and charting and making those decisions is really, really beneficial. So there are lots of different ways that you can do that, lots of different ways to participate. Sometimes, I've had clients in the past where she observes all day and then he charts it at the end of the night. So she'll tell him what she saw and they can put it on the paper together. Sometimes she'll write down the description and he'll just put a stamp with it that, kind of goes, because in Creighton we do a stamp and a description. So he participates in some way, but it can honestly just be consistent conversations. It can be the knowledge that we're going to make these decisions about when to be together or how we want to move forward together as a couple. Because I think a lot of times as women, we feel like if we're going to do a natural system, actually, even if we're not going to do a natural system, even if we're using birth control or having an IUD put in or anything else, we often feel like the responsibility of that is on our shoulders alone. Like it's up to us. If we're trying to conceive, it's up to us. If we're trying to avoid, it's up to us. Actually, it really is a partnership there. So coming up with ways, like talking together about ways that you can equally participate, that is important. It can sometimes be a little bit uncomfortable in the beginning, especially if you're not used to talking about these topics. But I know with my clients, I will give them suggestions. I actually give them a worksheet that they can go through that can kind of help them think about how to talk about some of these things. Because if you haven't done it before, then it may not come naturally to you, but it's definitely worth it to be a teammate there.
Sure. I love that. Amazing. Well, I love this conversation, but we are going to take a short break and we're going to hear a word from our sponsors. We're going to come back and we're going to talk more practical tips on how we can just optimize our fertility and talk more about the Creighton model. So we'll be right back. Hey y'all, it's Dr. Kayla Smith here. I hope you're loving this episode as much as I am. We will be back shortly, but first, let's hear a word from our amazing sponsor. Trust me, it's something that you'll definitely want to hear, especially if you're passionate about fertility and hormone health. Did you know that we have an exclusive herbal tea crafted especially for fertility, hormones, and reproductive health? This isn't just any tea. It's a nurturing blend of 5 potent herbs, each chosen for their unique ability to support fertility and hormone balance. Imagine the benefits of red raspberry leaf, nettles, chamomile, antioxidant-rich green tea, white peony, and the delightful rooibos vanilla all in one soothing cup. This delicious, nutritious tea is perfect for starting your morning or relaxing in the evening. So why wait? Head on over to our website, hormonepuzzlesociety.com/fertility-tea to support your fertility journey in the most natural and enjoyable way. Now let's get back to our insightful episode and continue our hormone puzzle journey together. Hey, Caitlin, welcome back.
Thanks. Glad to be here.
So let's talk practical tips. Maybe 5 things that you tell your clients to do just to optimize their overall health with this topic in mind.
Well, if I'm thinking about fertility awareness specifically,
Mm-hmm.
then I'm going to make it specific to how does fertility awareness, help with this, or what are 5 tips that could help with
Yes.
that, 5 steps. So I would say first to research your method. There are so many out there, but that doesn't mean that just any old method is going to be the right fit for you. So really find the one that you like best. For instance, I chose the Creighton model system because it only uses one biomarker, cervical mucus,
Mm-hmm.
and I felt like that was realistic for that phase of life. I could handle just
Yeah.
one thing. And it had that whole medical component. So I felt like, okay, this is legit. Like this
Yeah.
is actually studied and medical professionals use it. So it felt like it would be a good fit for me. But finding different things that matter to you in your particular stage of life really do make a difference. For instance, basal body temperature is a great way to identify what looks like ovulation and look at your post-ovulatory phase. There's so much great stuff that we can get from that. But if you're in a season of life where you're not getting, solid sleep at night, maybe you're having to get up in the middle of the night, that may not be the best fit for you. Or
Yeah.
if you have irregular cycles, then you may not want to use OPKs because it's going to add up over time having to use all those test strips. So that kind of thing. Just find what method works best for you. Second, I would say find a qualified and experienced instructor. I really do not recommend trying to find little bits and pieces of information online or on somebody's Instagram account or even from a book. Like you want this to be effective and efficient. And so one-on-one individualized instruction really is the best way to go about that. And so, if you're going to go for it, go for it. And then begin your education. Like once you've chosen your form of fertility awareness, invest in it. If you're going to do it, go all in. I personally have never worked with anyone who couldn't do it. Like everybody is capable of doing it, but you have to want to be there. You have to be ready to actually take part in it, and then you will definitely thrive. And then probably last would be to find a restorative reproductive medicine doctor or medical professional that you trust, who you trust. So find someone who is curious and thorough and dedicated. Like look for who will partner with you to get to the root cause and restore your health while honoring your personhood. I think a lot of times when we get sent to these fertility clinics, we go in with a lot of hope, but I know from my client experiences that it can often be kind of a sterile experience, and you can feel like you're just sort of on this conveyor belt of, okay, first we do this test, and then we do IUIs, and then we do IVF, it's just sort of like, okay, this is what everybody goes through. But instead, finding a medical professional who is really going to want your participation, because nobody knows your body like you do. And so you want somebody who's going to be a part of that communication with you and value that, and then individualize your treatment and your care. And I think that's really important too. So it makes a huge difference in the outcome.
Sure. I love that. And I completely agree there as well. I see more and more clinics really, I hate to say it this way, but they almost are taking the hope away from these women and telling them that their chances are minimal and just, really have just that negative energy where I see every day in my practice, women in their mid 40s getting pregnant naturally and having healthy babies. And so if your clinic and your provider is not providing hope and a clear plan of action, I think it's time to look for somebody else.
I think that's a great point, because I can't tell you truly how many clients I've had at this point who were told this same line, which is you have a 2% chance of conceiving naturally on your own. That number seems so hopeless. It seems so desperate. Like it leads you to despair, and it makes you think that, okay, well, maybe IVF is my only option. But these are all clients that I have worked with, which means they ended up coming to me to work with, and it doesn't have to be me, but I mean, they looked into other alternatives and they were able to conceive naturally without IVF, without even IUI. And so personally, I wish that I could work with clients that are kind of before they get to that point, before they step foot in a fertility clinic. And I think from my client experiences, a lot of ladies have told me that they wish the same. Like they wish that they knew about their alternative options, but instead they're just given this one thing. They're just given this one referral. And that conveyor belt that I talked about is really not right for everyone. Maybe not even most people, that tailored treatment makes a big difference. Like if you stop and think about women with underlying endometriosis, they really should not be injecting themselves with stimulating hormones that could radically worsen their endometriosis.
Yeah.
But rarely are these women, given the proper diagnosis before they're told to go ahead and start these hormones. And so that's damaging to them, not only just at their chances of conceiving, because as we know, endometriosis can really affect that, but also their overall health, their long-term health. And instead, we want to preserve and restore that fertility. And I think that when addressing the underlying root causes of infertility or of loss, it can also significantly improve not only birth rates and outcomes, which are important, but that overall health of mother and of baby. A lot of people don't know that there are some kind of scary statistics when going through some of those really strong fertility treatments. So you want to make sure that your long-term health is prioritized as well.
For sure. I love that. And you're speaking my language. I say this
I know it
all the time. So I completely agree with that. I love it. Oh my goodness, Caitlin. Well, we could be here all day, but we do have to start to wrap up. And first, I just want to tell you thank you. You're just such a wonderful guest and you provided a lot of knowledge and information to this audience. So I really appreciate that.
Well, thank you for having me. It is a joy to be with like-minded people who are all about empowering women and couples to understand their fertility, to prioritize their health, and to be honored and treated as the human person that they are.
Sure. Well, before we go, I do have a couple more things I want to do. First, I love to play a little game with my guests where I just let the audience learn more about you personally. So are you open to that?
Sure. Let's do it.
So how it works is I'm just going to ask you a series of questions. You're going to say the first thing that comes to your mind. Okay. Favorite food?
Maybe massaman curry.
Okay. Least favorite food?
Probably fish. I'm not a big fish fan.
Okay. Favorite vacation spot?
The mountains.
A bucket list item that you plan to do this year?
This year?
Yes.
Well, I have some big developments that are happening within Woven Natural Fertility Care that I'm excited about. So I don't know if I'm ready to say them yet, but there are some bucket list items that are happening.
Cool. I love it. Yeah, you can pass if you're not ready to answer that.
People just have to keep up with us to see what's happening.
There you go. You might not remember, and you can always pass, but first concert.
I believe it was John Mayer.
Oh, wow. Okay. Cool. I love John Mayer.
It was a fun one.
Yeah. Favorite animal?
It's a simple answer, but I gotta go with a dog. My sweet dog. I love him so much. So
oh my goodness. Dog. What kind of dog do you have?
He's a lab mix. His dad was lab. His mom was like a terrier kind of mix of everything. So
cute. Yeah. And then the last question, if you watch movies, what's your favorite movie?
I have to say You've Got Mail.
Oh,
classic.
Yeah. I love that one. Oh my goodness, Caitlin. So fun. Well, thank you so much again. Tell everybody where they can find you, where they can learn more about working with you. And you have a free gift, which is asking good questions in the doctor's office. Tell us about that.
Yeah, so it can often feel intimidating when you walk into a doctor's office to know what to say to help you advocate for yourself. So this simple tool gives you everything that you need to think through your questions ahead of time, to prepare for that encounter. And even if there's going to be some pushback from the medical professional, like ways that you can make sure that your questions are answered or needs are met. So that is available to listeners, and you can also access it through our website, wovenfertility.com/resources. There are lots of free resources there. And I also have a podcast. Woven Well podcast is all about natural fertility, and it's from a fertility awareness, specifically Creighton model system kind of user perspective. So those are two great places to get in touch with me. And I also offer monthly an introductory session that anyone can participate in. And it really gives a big picture understanding of how does the female reproductive system work? How does the male reproductive system work? And how can we use this information through the Creighton model system to be able to plan families and effectively learn more about our women's health? So all of that is at wovenfertility.com.
I love that. It's amazing. And then social media, did you mention social media? Where are you at there?
Yeah, we've got an Instagram account at Woven Fertility. I also write weekly on topics of fertility and faith. So a lot of times, we talk all about the physical aspect of fertility related questions, but there's also a spiritual aspect too that I think affects a lot of us. So that's it's wovenfertility.substack.com.
Okay.
And then we're on YouTube as well.
I love that. It's amazing. Well, any final thoughts? What's maybe a final piece of advice you want to leave us with?
I think I would want every woman to know that you are capable of doing this. Fertility awareness can often feel like a really overwhelming concept. Intimidating concept is an even better word. It just feels like it takes so much time and there's so much involved in it. But when you actually get started and you've got a trained, certified practitioner that's walking alongside with you, like I'm trained in how to help you be successful. That's my goal, is for you to be successful. And so we want you to win, and we're going to make sure that you feel confident and comfortable as you go. So even if you feel uncertain about whether or not you can do it, even if you feel like your doctors are uncertain about whether or not it would make a difference, I say, give it a go, give it a try, and see what you can discover.
I love that. It's amazing. Well, thank you again for being here.
Thanks for having me.
And thank you to everybody who's listening to this episode of the Hormone Puzzle Podcast. We are so grateful that you're here, and we'll see you next time. So bye for now. Hey, hang on a second. Before you go, I've got some fantastic free resources waiting for you over at our website, all designed to support your journey. When I was going through my own 2 years of infertility, I wish that there had been something like this to guide me. There just wasn't. And that's why I created these resources specifically for you. And here's a little secret. The strategies and the foods that I share in these resources are the exact same ones that helped me conceive, not once, but twice, even after being told that it wasn't possible. So trust me, I know these tools work. Make sure you check them out. And I can't wait for you to be my next success story. Thank you so much for joining me today. And don't forget to check the show notes of this episode. If you enjoyed our time together, please hit that subscribe button and leave us a review. This would mean so much to me, and it's how more people just like you can find our show. See you next week on the Hormone Puzzle Podcast.